Hi, my name is Carmen Bogle, and I am recording this video for NU 650. I give permission to be recorded, as does my participant. I've entered the room, I washed my hands, I've introduced myself to him. Hi, I'm here as your practitioner, and you're here to get your physical exam, is that correct?
Correct.
Okay, I'm going to briefly ask you some questions really quickly. How is your health?
Great.
All right, do you have any concerns today?
None.
How is your food and fluid intake?
Great.
Great. Eating a healthy diet?
Absolutely.
How many glasses of water are you drinking per day?
At least 8.
All right. Reports daily bowel movements?
Twice a day.
Okay, wonderful. Do you exercise?
4 to 5 times a week.
Okay,
for
great.
At least 45 to 60 minutes.
Okay. You get 8 hours of sleep a night. Do you have any past medical history or significant
I've had anal
family
fissures
history?
before, but other than that, that was in 2011. No.
Okay. Okay, great. No recent travel?
No.
Okay. Do you smoke tobacco?
No.
Okay. What about drink alcohol?
Yeah, maybe 3 to 4 beers a week.
Okay, perfect. Do you use any recreational drugs?
No.
Okay, are your immunizations current?
Yes.
Okay, excuse me, do you currently take any medications?
Other than vitamins, if you call that medication.
Yes,
but no.
over-the-counter medications would be yes. So, do you have any allergies to food, environmental allergies, or
No.
drugs?
No.
Okay, and my records say that you had your last physical exam
Last year.
about a year
That's
ago.
what
Okay,
I'm
perfect.
here.
I see here that you practice safe sex, you feel safe at home, you haven't traveled out of the country, and you haven't been around anybody recently that's ill, correct?
That's correct.
All right, so we're gonna start your head to toe assessment with your head, neck, and face, okay?
Okay.
So I'm gonna start by just feeling on your head here, and I'm checking to make sure that it's normal cephalic, and that I don't feel any lumps, bumps, or bruises. I'm also just gonna look it over, inspect, look at your skin, the characteristics of it, make sure everything is, your color is fine, that you don't have a temperature, that everything is symmetric. It is. Also, I am going to, so that's your head, okay, and then I'm going to assess here your masseter muscle. Can you open your mouth for me, please? Okay, great, okay, and then can you move your jaw around? Okay, great, that's cranial nerve 5, that's awesome, okay, and then I'm going to feel your temporal muscles here, and then I'm gonna just palpate your frontal and your maxillary sinuses. Okay, can you raise your eyebrows for me? All right, can you smile? Puff your cheeks. All right, all right, and okay, so that is cranial nerves 5 and 7 that I'm just looking at there. Now I'm getting ready to check your lymph nodes, your preauricular, post, occipital, superficial cervical, posterior and deep cervical. I forgot the tonsillar and the submental and the submandibular. Okay, and then here is like the supra clavicular and infraclavicular. And while I'm right here, I'm just gonna go ahead and check your maxillary. Sorry, I didn't mean to tickle you there, but I just didn't want to forget those lymph nodes. Okay, so that was no discomfort there with your lymph nodes. And then also I want to assess your thyroid. Can you swallow for me, please? I'm sorry. Okay, great. Now let me, first of all, palpate your carotids, both sides. Not do it at the same time, because that could be a problem. And then I'm gonna listen with the diaphragm of my stethoscope as well as the bell. Listen for fluids. Do the same thing over here. Wonderful. And while I'm there, I'm also gonna just look at your jugular vein for pulsations. Okay, everything looks fine there. Can you move your neck, do range of motion in your neck for me? Okay, side to side. Perfect, okay. And then can you raise your, okay, that's cranial nerve 11, that's great, okay. Now the next thing that we're gonna look at is your eyes, okay, and I'm looking at your eyebrows, and I'm looking at the eyelashes and everything, and making sure it's symmetric. Looking at your palpebral fissures there, I'm gonna palpate your lacrimal apparatus, couldn't get that out. Okay, and then the next thing I'm gonna have you do is I'm gonna check your visual acuity by having you do the Snellen test. So I want you to look at that and read to me the lowest line that you can read there, please.
The lowest.
Yes.
L T F P H.
can you do the other eye as well?
LTFPH.
Wonderful, okay. So while we're on your eyes, the next thing that I'm gonna do is I'm gonna check how your eyes respond to light. I'm gonna check direct. I'm looking for your pupils to constrict. Okay, perfect. And then I'm gonna also look at consensual. I'm looking at the other people as I do that. I apologize, I know that's bright in your eyes. Okay, and then I'm gonna do accommodation. Can you just follow my finger in, please? Okay, awesome, perfect. Okay. Turn this light on, and then I'm gonna do the ophthalmoscope part of your eye. And then also with your eye, I needed to assess like your conjunctiva, your sclera, and your iris. Can you just pull your eyes down for me? Okay, great. Now I'm gonna hold it in my left hand, and when I'm doing that, I need to be looking at your left eye. Okay? And just keep looking straight, please. Okay? And then I'm gonna do the same thing over here. Now I need to hold it, I'm sorry, in my right hand. And look at your right eye. Okay? And your red reflexes are there, so, okay, great, no problems there with your eyes. Now we're gonna go on to your ears, and you also told me that you haven't had any problems with your ears. The first thing with your ears is I'm gonna do, I'm just gonna take my fingers and you tell me, can you hear that? Okay? Okay, perfect. And then I'm gonna press this ear, and then I'm gonna say a number. I want you to tell me if you can tell me what number I say.
59.
Okay?
88.
Okay, perfect. Okay, now we're gonna test your ears for lateralization. So I'm gonna put this, and I want you to tell me if you can feel the vibration equally in both of your ears. Okay, perfect. All right. And then tell me when you can no longer feel the vibration here. Okay. Can you hear your vibration?
No.
Okay. Tell me when you no longer can feel it. Okay. And then can you hear it?
No.
Okay. Perfect. So air is greater than bone conduction, so you don't have an issue with hearing. It could have been a problem with me as the vibrator, as the person using vibration there, because you should have been able to still hear it ringing, because air is supposed to be greater than bone. Okay, so we checked, we did the Rene and the Weber. Now I'm going to do your otoscope, and I'm looking at now, and I'm inspecting the auricle and the tragus and the mastoid. And then I'm gonna do the the ear exam. I'm looking in there, I don't see any cerumen, I don't see any swelling or discharge, and I do see your tympanic membrane, and it's a pearly gray. I'm gonna go do that on the same side here where I've inspected the auricle and the tragus and the mastoid, and I'm looking in there. And with adults, you hold the ear up and out, and no cerumen, no swelling or discharge. Okay, so that is your ears. And then now we're going to go to your nose. And then with your nose, I just need to look at your terminates, make sure I don't see any deviated septum, make sure everything is symmetric. I just need to look in here, make sure I don't see any polyps, any problems. Okay, make sure it's patent. Can you smell out of both sides, okay? All right, okay, close your eyes, please. And can you tell me what you're smelling here?
Ginger.
Okay, awesome. Now I'm going to look at your mouth and assess your mouth. Can you open your mouth for me, please? I'm looking at your gums, your mucosa. I'm looking at your teeth, dentation. You have all your teeth. You don't have any cavities. Lift up your tongue. Okay, great. Can you move your tongue around? All right, can you say ah?
Ah.
Okay, great. That's cranial nerve 10. Range of motion of it was cranial nerve 12. I forgot to say that with your forehead, your face, I was checking like cranial nerve. 5 and 7. Can you feel that sensation there?
Mhm.
Okay, great. And while I'm doing that, I want you to also, I want you to tell me whether or not you feel, if it's like sharp or dull, okay?
Okay.
Okay,
Sharp.
okay, great.
Dull. Sharp. Dull.
Okay, I'm gonna also test that on your back.
Sharp. Sharp.
Okay, then check your thighs.
Sharp. Dull. Dull. Dull.
Okay, great. Just checking your sensory there. Okay, so I've checked your head and I've checked your eyes and your nose and your mouth and your ears. Okay, can you do the range of motion of your neck for me, please? All right, move side to side. Okay, great. I can't remember if I checked your lymph nodes or not because I've had to record this video several times. So, all right. And did I listen at your carotid?
Yes.
Alrighty, okay, perfect, okay, sorry about that. Okay, so now we're gonna move to your upper extremities, okay, and with your upper extremities, I'm checking your arms and your hands, your wrists, and so in your hands, I'm checking for circulation and making sure your capillary refill is less than 2 and that you don't have any clubbing or cyanosis, and that looks great. And I'm also gonna check your pulses here, and now I'm checking your radial as well as your brachial. And then I'm palpating your epitracheal nodes, okay? And I would do that on both arms. And then also now we're gonna do range of motion. So I wanna do range of motion of your shoulders first. If you could do like internal and external rotation for me, perfect, okay? And then also with your shoulders, I just kinda went blank there as to what else, oh, abduction and adduction. And then if you could do extension, take your arms back, okay, perfect. All right, and so with your hands and your wrist, what we're gonna do, like supination and pronation, okay, and then take your wrist out and in, okay, perfect. With your fingers, this is called thumb opposition, okay, great. And then I want you to open them and close them, and then I want you to do flexion and extension, okay. Okay, perfect. And then I want to do your posterior back. So right now, I'm inspecting everything and I'm looking at symmetry. I'm checking like your respirations. You know, I'm looking at the rhythm of everything and seeing how deep you're breathing. I'm looking at the color of your skin. And then when you feel my hand moving around, I want you to say 99 because I'm checking for tactile firmness, okay?
Okay.
All right.
99. 99. 99. 99.
Okay.
99.
And I'm also palpating the
99.
coastal vertebral
99.
area here on your back.
99.
Okay.
99.
Okay, perfect. Now I'm going to percuss.
99.
No, you don't have to say anything, honey. And as I'm percussing, the sound should be reticent. Okay. Now on the front side, I am palpating, and I'm palpating, checking just for heaves and crepitus and crepitus. I'm sorry, I didn't say that right. And pulsations. Okay. And then I'm also gonna percuss here. Okay, I just realized in the back I failed to listen, so I have to auscultate. All right, deep breaths, please. Okay, perfect. So on the front side, I need to listen at the, I need to listen with the bell as well as the diaphragm. So American people eat too much. Okay, then I need to palpate your PMI, which is at the 5th intercostal. It's on the left side here. Okay, now I need to go through, switch and listen with my. Okay, excellent. Okay, so I listened to your interior, your posterior, your neck. I need to just look at it because I'm assessing, looking for the jugular vein like pulsations, and I don't see any. Okay, so at this time, we are going to, I'm gonna have you lay down, please, in a position so that I can go ahead and assess your abdomen. All right. And I need you to lay your head down in this end, please, if you could. Thank you. And with your abdomen, the first thing that I'm gonna do is listen. Okay? Sometimes you hear a fancy word, auscultate, but I'm gonna listen in all 4 quadrants. And I apologize, I have to, so you just relax. Okay, then I'm also gonna listen at the aortic artery, then listen at your renal arteries, and your femoral arteries, and this may be a little ticklish, but while I'm there, I'm just palpating your inguinal area because I'm feeling for hernias or lymph nodes. Okay, it's fine there. So now with your abdomen, I need to, I've listened, and so now I'm going to percuss, and I'm percussing for dullness or tympany, and I've inspected it. I did that first, making sure that it was symmetric, there was no deviations in color or temperature or anything. So now all right, and so while I'm percussing there, I'm also gonna go ahead and percuss, and I need to percuss the spleen and the liver. And so the liver is here on the right, the liver border, and then the spleen, dullness, and then, but my palpation first, I'm sorry, I know you're ticklish, honey. First, the palpation is light in the abdomen, and then there's deep palpation, and then also I'm palpating over here at the liver, as well as my spleen. Okay, all right, so now if I could have you go ahead and sit back up for me. Thank you. And so while I have you standing, I'm gonna go ahead and have you do some of the, where I'm testing your gait and everything. So could I just have you like walk toward the camera, please? And then walk back toward me, okay? All right. And then can I have you walk toward the camera like on your tiptoes, but then walk back on your, come back on your heels? Okay. All right. And have you ever heard of the tantrum walk or like the drunk walk? Can you do that for me, please? All right, perfect. Okay. And are you able to just stand in place on one leg?
Mm-hmm.
Okay, perfect. And then are you able to do like a deep bend of your knees? Okay, or with both legs down. I'm sorry, I wasn't clear. Yeah, so I would say that's kind of challenging. Great. And then can you bend over for me so that I can look at your spine? Just looking at your cerebellum. Checking out everything there. Okay, perfect. Okay, and then can you rotate at your waist like side to side for me? Any discomfort with any of that?
No.
And then back and forth?
No.
Okay, awesome. All right, you can have a seat there on the chair, and then can you take your left foot and take your big toe and then take it down your leg? Okay, and then can you do the same thing please with the other one? All right, and then I want you to close your eyes, because this is called point sense, and I want you to tell me with your big toe, which direction am I moving it? Like up, down, left, or right, okay? Your eyes are closed, okay?
Down, up, left, right,
Okay,
down, up, left, I mean right, left.
okay, perfect, no problem. Okay, the next thing that I want to do, I'm gonna give you some exercises that I want you to repeat after me, okay? So it's taking your hands on your legs and taking them back and forth real quick, okay? Awesome, okay, and then can you take your index fingers and alternate touching your nose? Okay, and can you do that with your eyes closed? Okay, perfect, okay, can you open your eyes? And then I want you to take your index finger, alternating it, and I want you to take it and touch my finger. So each time, like touch that finger and then take that finger to your nose, and then do it with the other finger and take, okay, great. Okay, now are you able to do the same thing with your eyes closed?
Mhm.
Okay.
Oh.
Okay. Okay, excellent job. All right, stand up, please. And then I want you to close your eyes and then turn your palms up and hold your arms straight out. Okay, and then I'm gonna push your arms down and I'm gonna see if you're able to put them back in the position. Okay, perfect, okay. And then you can open your eyes, please. And then are you able to put your feet together?
Mhm.
Okay, put your arms at your side. Okay, you can open your eyes. And now I want you to do the same thing,
Mhm.
but then close your eyes. And I'm checking to see if you're able to, you know, you're not swaying or wavering or anything. Okay, that's excellent. Okay, now, if you can have another seat, I'm gonna check your vibration. I'm gonna see if you feel vibration in your wrist and in your Achilles
Okay.
tendon.
Mhm.
Okay,
Mhm.
okay, great.
Mhm.
Okay,
Mhm.
okay, awesome. And then the next thing that I need to check is I wanna check your reflexes. I'm sorry, so I'm gonna check your reflexes here in your brachial radial. So just relax, okay? And close your eyes, because sometimes, okay, great. That's your brachial. I mean, I'm sorry, your bicep and your tricep, sorry about that. Didn't mean to scare you. Okay, I'm gonna do the same thing over here. Brachial radial, okay? Bicep, tricep, okay? Then I'm gonna check your patellar. Good job. Patellar, sorry, not did you so hard. Then your Achilles. Okay, great. Then the next thing that I need to check, let's see, I checked all your pulses. I need to check your lower extremity pulses. You have 3, so there's your popliteal. You can just relax for me, please. Your pedal. And then your posterior tibial. And I'm gonna do the same thing over here. Okay, so now I just need to check the range of motion of your lower extremity, so I apologize because I should have left you on the couch. So if you could get back on the couch for me, please, I appreciate it.
Head here.
Yes. Okay, so the first thing we're gonna do is check, your knees. If you could just, flexion, if you could take that knee to, yes, okay, great, and then extension, if you could do that with the other one, perfect, okay. Now I want you to lift this foot, and then I want you to take this leg underneath it, because we're checking for abduction, okay? Okay, and then can you bring this leg out? Okay, the end was adduction, okay? And then we're gonna do the same thing with this one, if you can bring this one over, yes, and then it's kinda hard to take that out, yes, okay, great. And then, what did with the hips. Oh, shoot, trying to remember here. And I kinda lost some of the hip flexion or whatever, I can't remember, but with your feet, we're gonna practice the dorsal and pedal. So if you could take your feet and pull them towards you, no, the heel of your foot, flex it towards you, now flex it down. Okay, wonderful. I just remembered too, I forgot to check for the Babinski, which should be negative in adults. Yes, it's funny. Okay, perfect. I'm forgetting some of the hip, and I can't remember what, flexion, extension, abduction, maybe not, maybe it is just those 4. Okay, so I did your hips, your knees, your ankles. When I do my assessment down here, again, I'm just checking for hair distribution, temperature, making sure your legs are symmetric, that there's no, that there's good circulation. I checked your pulses there. I checked all your pulses up top. I mean, I want to say that I'm completed here. I just feel like I'm missing something, but however, thank you for, on a male, I would do a breast assessment, which we don't have to do this today, and I would be checking for enlargement and symmetry of your breast, and then I would palpate the breast tissue just to make sure that I don't feel any lumps, bumps, or bruises. So I think,
Did you wanna do that?
no, I think we're good to go. I need to check the 1 point, 2 point, I just remembered. So if you could tell me when I touch you with sensation, if you're feeling 1 point or 2 points, okay?
Okay.
All right,
2, 1,
sorry,
2, 1,
okay? I'm gonna do it up top now.
2, 1, 2, 1, 2, 2.
Okay, and then one other thing, I need to put something in your hand, and I need you to tell me what it is that I have in your hand, please, if you could identify that.
Cat.
Okay, all right, awesome. Yes, I think that concludes our testing, thank you.